Sore wrist after starting to care for your baby? I'm here to help with that. My name's Kristen Norwick. I'm a physiotherapist, and here at Caregiver Physiotherapy, we empower you to make informed decisions about your health. Why is it so common for the wrist to get sore with new caregivers, new parents? Well, you have to do a lot of new movements that you're not used to doing when you're caring for your baby. So in this video, I'm going to talk specifically about Quervain's tenosynovitis, which is when you have pain or discomfort in the thumb side of the hand or wrist. So if your wrist pain is Quervain's, most likely if you put your thumb inside your fingers and then you bend your wrist that way, if that flares things up or if it's painful, if it feels really tight and uncomfortable, you most likely are dealing with Quervain's. So ensure you book with a physiotherapist so that you know what exactly is going on with your wrist. So Quervain's is the most common wrist and hand injury that people deal with when they're caring for a baby. And that is because you're using this wrist movement in this direction repetitively. So generally, when you pick up your baby, there's this instinct to grab baby, especially when there is little to no head control for the baby, and lift through your wrists like this. It's just a common instinct. Tons of people do it, so don't be hard on yourself if you've done this as well. And that repetitive movement can actually flare up the tendon that is responsible for that movement. So the tendon that attaches to the muscle responsible for doing that wrist movement. And so the absolute best way to prevent this or to stop it from getting worse is, instead of doing that wrist movement, to lift through your elbows. So grab and hold, try to keep your wrists as straight and neutral as possible. And then lift baby by bending and straightening at your elbows, because your biceps are way stronger than these small forearm muscles. So they're way less likely to get irritated than those wrist muscles. So that's the first thing. Just keep your wrists neutral. If it's already painful, it's really, really good idea to start seeing a physiotherapist as soon as you can. Physiotherapists can give you an exercise program that is specific for your needs so that you can figure out how to strengthen that tendon, how to maybe relax the muscle if it's tight at all, and make sure that you're able to basically build up what your body needs to still care for baby without flaring up that tendon. After physiotherapy, other treatment options that are available are wearing a brace, getting injections into the tendon area, or even surgery as a last resort. The absolute best way to get on top of this wrist pain is through physiotherapy. But if that's not working or if it's not helping, then moving on to the next treatment options might be what's best for you. Your physiotherapist can help you understand when you can wear a brace. It's really important, though, that if you are using a brace, that you don't wear it 100% of the time, because if you're wearing it all the time, you're actually going to lose your strength because your brace is taking on the role that your muscles would be doing. So you want to only wear it at times when you notice your wrist pain the most. So when you're really, really using your wrist a lot, taking it off when you don't need it. And then you'll want to speak with a doctor about potential for injections if you're still not seeing improvement with physiotherapy and proper bracing. And then, of course, same thing going down the route of surgery, but that is super uncommon. It's really, really rare that someone would get to that point. So definitely don't worry. Don't stress about it. If you haven't tried physiotherapy yet, try it. And if you have and you're not gaining very good success, then you could always try working with different physiotherapists, or you can make sure you talk to your primary care provider, like your general physician, about it. If you're looking for a physiotherapist to help you with this wrist, hand, thumb pain, then visit the link in the description of this video to book with one of our physiotherapists, and we can see you online and give you the tips, tricks, and exercises that you need to get better. If you have any other questions, you can always write in the comments below or send us an email. Thanks for being here. Bye!